Katrina.
Hi, how are you?
I'm great. So today on Dental Elements podcast, we have a great special guest, Katrina Klein. You guys probably have heard of her on all over social media and at events and as a speaker. I will let her introduce herself a little bit more since she knows more about herself than I do.
Thank you so much. I appreciate the invite. These are always so much fun to come on and talk to people, talk about ergonomics and fitness and dentistry and how we can make things better for ourselves. But so for myself, I am Katrina Klein. I am the CEO and founder of ErgoFitLife. I have a Facebook page, a Facebook group, an Instagram. If you look up ErgoFitLife, you're very likely to find me. Of course, I have a website and all that good stuff too. I'm a dental girl. I've been in dentistry since I was 19, started out in the front office. I worked for Dental for 5 years until I got into hygiene school, and I've been in dental hygiene for 15 years. So I still practice full time. I know everyone's struggle in today's world. AC after COVID.
I know it's like the C word.
So I know what we go through, and I know the struggles. I know the physical impact that we go through, and thanks to a lot of physical work that I've done myself through bodybuilding and trail running and Spartan racing and all the things that I do physically as well as ergonomics training, I've been able to maintain a pain-free career, and I love to help other people get there too, because there's no reason why we have to end up in disability or in pain at the end of the day. It's a tragedy. So my goal is to save one body at a time when I'm not in the operatory by helping us to relieve pain or prevent pain in the first place. And then, of course, when I'm chairside, I'm always saving one mouth at a time. So that's me a little
That's
bit.
good. Just saving bodies and mouths. Nothing important, right? Saving careers.
Saving careers, putting the disability people out of business,
Yes. Yeah. Let's get back to that insurance. So yeah, disability insurance. And you said you worked for Delta Dental.
I did for about 5 years. Yeah,
wow.
it was actually a great experience for me. I learned a lot from it. They were the first to introduce me to ergonomics training, actually.
Oh.
I got my first intro to what an ergonomics assessment looks like, how it's done. I got to pick the brain of the person doing it. So it was enlightening to me because I was able to take something that I was taught there and apply it to dentistry. Mm-hmm. Although when I got my ergonomics certification, I asked flat out, but what do you do about dental people? Because so many of the examples that they gave us were not transferable. The principles didn't apply to us because our workspace is so different. And I was told flat out, we don't deal with dental people because they don't listen. And I stood right up and I said, well, I'm going to change that. And now that company that I was certified through has a dental ergonomics training course. So
now you're changing it. Good. Yes, I love it. And we need that for sure. And then going from an insurance company to the operatory, that's kind of what I did too. I worked up front with dental insurance. It's not for an insurance company, but you learn so much. And then you go to the back as a provider, and it's like kind of all goes together, and it's interesting.
Absolutely.
That's a good.
Well, I think too that especially when I go do ergonomics assessments for office teams, the front desk staff has their own set of individual problems that they're dealing with as far as ergonomics are concerned. So I have the experience of doing front desk. I did front desk in dental for 5 years. So I did insurance, I did scheduling, I did answer the phone. I understand what that feels like and the tax that it takes on your body at the end of the day. So it's fun because I get to give feedback on something that I have done. And I think that lends to my credibility. And then when I go and I speak in public, I can also say, okay, so for you assistants in the room, although I've never been an assistant, I have assisted many times. Mm-hmm. And most of the offices that I work at, we are oftentimes cross-trained. We get to jump in sometimes and help do different things. So having that across the board experience has lended a really good benefit to me starting this company and helping people. So I love it.
Yeah, for sure, because you can understand that everybody needs help ergonomically in the dental everywhere, but in the dental office, it's not
Yeah,
just
we're all in pain.
right.
We're all in pain. We go home and we drink wine and pop Advil because we have
Yes.
to.
And take hot baths with Epsom salt and cry
Right.
until the next week. And that it shouldn't be that. It doesn't have to be that way. And so we have you here to help people prevent that from happening. So you speak, I know you speak in conferences all over, and then do you go into practices at all?
I do, yeah. So I speak for dental teams. I'll go in like on a lunch hour or on a Friday. You know, a lot of the times doctors will have me come for staff development days. Oh, there's my dog. I'm sorry. That would be Charlie. So he goes. They'll have me in for staff development days and things like that, and team building. A lot of the times the doctors will gift, you know, something like this to their staff, and so they want to see them improve, and because everyone's complaining of pain all the time. Mm-hmm. And so I'll go in and I'll do, you know, I'll give my lecture, and I'll even go through stretches and all the things that I do with people. And oftentimes they'll want me to do assessments for them right there on the spot, because the truth is none of us are the same. You know, our bodies are shaped and sized differently. Our operatories are shaped and sized differently. Some of us are left and right-handed. So there's the basic things that you simply can't get around, that there has to be a workaround for. And that's what I do. So it is really exciting to get to go to dental offices and put together programs for all the teams.
Right. And then the operatories, because they are so different. Sometimes they're so small, we get so much more equipment and so much more technology, which is great, amazing. But then we're cramped into tighter spaces too, and trying to work around our equipment. And so
right.
you to go in there and help show different ways of moving things where possible, or adjusting the chair. Sometimes it's just a matter of moving the chair over, you know, slightly tilted.
Right. Yeah, I mean, the first thing I do is I will, you know, talk to somebody about how they're sitting. I'll make sure that they're sitting correctly in their stool or their chairs to the best of that room's capacity and their body. So if their equipment is limited, that makes it more difficult. But if I can get them in the most optimal place, that's going to help them, you know. And then we work on the room setup, you know, how the chair is positioned in the room. Can they get to 12 o'clock? If they can't, can we swivel the chair? Things like that. Can we move the chair towards the window or the wall that's by the foot of the chair, the patient chair? So there are things like that we can do that are very simple, easy moves that there's no equipment, you know, purchasing required. We look at, you know, where are the keyboards? Where are the counters? Where is there a way to make this easier? Do you have carpet in the operatory, which I shouldn't have carpet anymore. If so, please go to Office Max and get yourself a mat.
Right.
You know, basic stuff like that. So, you know, there's that. And then I will actually work with them one-on-one as they're treating patients, real life patients. So no production is lost. You know, patients still get seen. And I can cue them, move your hands this way, move their head that way. But, you know, lay them back this way, adjust the headrest like that. And all of that one-on-one coaching that we never got in school, because, you know, in hygiene school, they give us like 5 seconds of ergonomics training. And in dental school, I'm told it's like 2 weeks, maybe, that they even, if you're in a good program, that they can address some of it. So it's just not enough, because it's such a crucial part of what we do and the ability to maintain a career for a long time.
Right. Yeah. School, you learn so much, which is great that you need to know, but there's only so much time and only so much they can teach you. So it's up to you, up to us as professionals to finish that training and add to it, and take courses and hire people, like you hire coaches for ergonomics and other things, and finish your own education on the job in real life, because that adds a lot to your career.
Absolutely. You know, they say that going through school gives you just enough knowledge to not be dangerous. Right? And that's why we have to go and continue our CE and continue, you know, we have to continue learning, because first of all, like science, dentistry is evolving, you know, and we learn more about our body positioning, and we learn more about everything. And so what we learn in school is just enough to get you a basic knowledge of your craft. And then you get out and you perfect it with practice and mindfulness and knowledge and furthering things and talking to people. And that's what I do. It's helping someone, give them the knowledge, give them some practical one-on-one experience, and then they get to go and be mindful about practicing that and honing that craft. I mean, you can't go in and do one implant and say, I'm a master, I'm the implant master, folks. I am the one. You can't do that. You got to do it a few times.
Right.
Right?
Yeah. So in school, we learn how not to hurt others. And so afterwards, we have to learn how not to hurt ourselves because we're so focused on not hurting others.
Right. Exactly.
So what's the, when people call you, is it after the vertigo and pain, or is it preventative, or is it kind of both? Or when's the best time to have an assessment and have training?
So those are two questions. The best time is preventively, right? So we are, as a hygienist, I'm prevention minded. And I consider everyone in dentistry to be a prevention specialist, whether you're a dentist or you're a hygienist or you're assistant or front office. We should all really be prevention specialists. But thankfully, our doctors have the knowledge to treat, right? So the best time to do any kind of, learn a skill that's going to prevent illness is going to be earlier. But unfortunately, because when we get out of school, we're so busy learning to hone our craft, we oftentimes just think, okay, I got to pass my student loans. So I'm going to work as hard as I can. And, I'm 25 and I'm 10 feet tall and my body doesn't hurt right then, right? So most of the time I get calls at the end of someone's career. I get that 10-year phone call is what I call it. Katrina, I've got 10 years left. I still got kids in college. I still have a practice that I have to maintain. I'm not even done paying off my mortgage. I need 10 more years and I'm canceling days. Can you help me? I've already seen a chiropractor. I've already seen a massage therapist. I'm doing all the things. I have all the equipment. They're telling me I need surgery. What else can I do? And that's the majority of the phone calls that I get. Is I'm already in pain and I'm terrified because I've tried the traditional things. Mm-hmm. And it makes sense because what do we do when we're in pain? We go to our MD, who sends us to our PT or our chiropractor or our MT, our massage therapist. So the last person you're going to go to is your RDH friend, right? Because
who knows?
So that's why it's essential to have things like certifications, and I am also a certified personal trainer. I took my bodybuilding experience and I started helping colleagues, and then they said you have to share this with people. so I got my certification for personal training and all that stuff. So those things give me some credibility. But more often than not, it's testimony. It's people that I've helped that they've had that 10-year phone call and they're like, what am I going to do? I can't give up my practice yet. I still have to work.
It's really scary. I had an incident where I had pain all of a sudden, and you don't realize how much you use body part until you can't use it. And especially when it's for your career and it's just in so much pain, you're just like, oh my gosh, what do I do?
Yeah.
And
you call Katrina.
Yeah. And I was so worried about my neck. Usually it's your neck that hurts or your back. And patients are, does your hand hurt? I'm like, no, my hand doesn't hurt. Well, until we couldn't use Cavatron. But then all of a sudden my hand started hurting, so I probably jinxed it. But then my arm started hurting. I'm like, oh, it does, because you're so focused on protecting your back that you use your arm, and you're giving up other body parts to protect ones you're afraid of. And so to have what would you recommend having, like an overall, like you're a bodybuilder, having your core and your overall body strengthened as well, and then your positioning of how you're holding yourself?
So that's a big part of what I do, because fitness is such a huge part of my life, and I've seen the results of posture enhancement. I actually grew half an inch after the age of 35 due to bodybuilding. So it's all about your posture and having symmetry in the body, because when we work in an asymmetrical environment, which is dentistry, we lean, we turn, we trunk, we twist, we do all the things, and it's uneven because we're working with one hand doing one thing, another hand doing another thing in different functions, and we've got chicken arm, we've got all the things, right? So having and establishing symmetry in the body and balance in the body is essential to getting A, out of dysfunction, but B, to having good posture. So I have a workout program that I do with people. I work with people for 3-month sessions at a time, dental professionals, of course. I also deal with other people too, but the majority of my clients are dental professionals, and we work on posture enhancement. And the whole purpose of that is so that you can not just work on your core, but because if you just work on one part of your body, you're going to have an imbalance. You're going to have asymmetry. And we know, just like in the mouth with the occlusion, you need to have a balanced occlusion. You need to have equal load on equal parts, right?
Mm-hmm.
The body is connected in that way. It's a system, and our muscles work the same way. If we have tiny muscles that are compensating or overcompensating for large muscles because they've become fatigued, tiny muscles get problems too. That's what we call the twins in the back of the shoulders between the spine and shoulder blades.
Mm-hmm.
The muscles that the massage therapist literally can never get out.
Right.
Those big knots. So that's a big part of it, is just establishing, good postural health, core, back, chest, shoulders, legs. Something a lot of people don't know is that the glutes are the largest stabilizers in the body. Who knew?
Yes. Yeah.
But we don't work on those in dentistry. We sit on those.
Yes. And I see people, not in dentistry, but men with lower back pain. And I'm like, you should do some butt exercises to hold that back up. And I'm always thinking of that because, you're using your back pretty much to hold your butt down. Maybe.
Right. And that also has a lot to do with how they're sitting in a chair.
Mm.
Because when we sit in a chair in a traditional stool, for example, we've got our legs at 90 degrees, and that actually rotates your pelvis under, which pushes your lumbar spine back, flattening it. And that is painful. That's not natural. That's not how we're supposed to be sitting.
Uh-huh.
One reason I recommend a saddle stool, because it keeps you and your legs at more of a 135-ish degrees. You're almost standing like on a tripod, if you were to imagine something. And that will keep your pelvis from tipping under. And when you do that, you can maintain the natural neutral curve of the spine. So it's all connected.
Mm-hmm.
It's using the equipment in the right way. It's positioning yourself in the right way. It's having the muscular integrity to do the job that we need to do. Because frankly, I call us dental athletes because we have an extremely laborious job. Our job is very hard. And I know patients don't recognize that. They're like, what do you mean you just fell away? And that's not right, because we are chronically contracting so much of our body all the time. Mm-hmm. So that's why we're fatigued at the end of the day. We've expelled so much energy by just tensing and holding ourselves, and we put our shoulders up as earrings,
Mm-hmm. Or I see people walking like this all the time with their shoulder forward.
Uh-huh.
Yeah.
Yeah, especially
saddle chairs. I find myself sitting in regular chairs like this now with like a saddle. I was at a course last weekend and I sit like I'm in a saddle chair. I'm like, oh, that's weird. It must be because I'm used to doing that now.
Right, you lean forward.
Kind of, yeah. And I have my legs kind of down and.
Oh, yeah. It does help when you, like I said, it's about mindfulness. And so if you are routinely focusing, or you have something that you do, for example, when we tell patients to learn to floss by associating flossing with something that we're already doing, excuse me, I have a frog.
Yeah.
Then they get used to doing it that way, right? So if we have something that we do regularly, the one thing I teach in my courses is to take a deep breath before you enter any mouth. When you do that, you automatically make your shoulders go down because your chest rises and your shoulders go back and down in more of a neutral posture. So if you just take a breath, a nice deep breath, and you go in, that's going to set you in more of a neutral position. But if you do it every single time, then your body gets used to that neutral position. And so it's being mindful of the ways that we consistently do things with our body. They're neuromuscular, they're neuromuscular patterns. The same way we learn how to walk. We learned how to sail in a certain way because we were mindful about the way that we constantly did it. Mm-hmm. We can repetitiously unlearn bad posture. Mm-hmm. It's possible.
Yeah, that's great.
I know, it's so funny.
Before I do an injection, I always kind of look up first for some reason. I probably do that. I get my posture ready because you could get stuck there. And so people probably think I'm praying. The patients are probably nervous because I'm like looking up and taking a deep breath.
I know. I have similar things that I do when I'm polishing. When I go to polish, I always, reset my body. I would say reset your shoulders. So I take a deep breath. But when I polish, I contract my core the entire time. Even if I have to, if I fatigue and my muscles give out, then I just recontract it the whole time. So because polishing is, for me, it's not as taxing on my extremities So I can kind of just do that, and I get to do that 8 times a day.
Oh, nice.
Right? It's
Yeah.
it's a multitasking thing. I don't actually have to really think about it because I'm also giving OHI and looking and thinking about my time.
Mhm.
And is the doctor ready for me to come in? And is my next patient, you're doing all these other things, but
Mhm.
it's one thing that you can almost mindlessly do. You're just contracting. And when you're giving OHI while polishing, for example, or you're talking while polishing because it's a great time to talk, you can breathe while contracting your abs, which is even better. So it's a good training device just to do. I mean, it takes what, 2 minutes to polish?
Mhm.
So 8 times a day, two
Yes.
minutes each.
Yeah.
I mean,
Yeah.
there's so many little things that we can do.
You have so many little tweaks that
Uh-huh.
make your life so much better and
You
pain-free.
know,
Yeah,
food
so it's
service.
kind of like habit stacking, where because you learn a new habit and then you stack it with something else that you're doing, and so then every
Yeah,
time you're polishing, you do that. Before you know it,
absolutely.
you're perfect. Yeah.
I think that so I was talking about that the other day, and someone said it was from a book called Atomic Habits. I haven't read it yet,
Oh yeah, it's
but is that where it's from?
I think yeah, I think that might be one. I've read so many books, but that's a great book. And then habit stacking. I don't know if that's part of that or or there's another one about habits and or
Got
the
it.
power of habit. I think it's so
Okay.
good. It's life changing.
Yeah, and that to me that is so relative. I have to read those books, but it's so relevant to the way that we can incorporate all of this stuff into our practice.
Hmm.
Because at the end of the day, we work because we want to help people. We work because we love giving. We are healers. We put ourselves really through it if you think about it. But we also work because we need to make money, right? Because our mortgage company really frowns on us when we don't pay them for some reason. I
Yeah.
don't understand. So, so we need to make money, and if we are tired and fatigued and in pain, how much more or how much less productive do you think that you are when you're in that circumstance versus when you are energetic and your 4 o'clock patient gets the same you that you were at 8 o'clock?
Right.
Because that's what they deserve.
Right.
And we deserve that too. Because if we can be the same energetic person at 4 o'clock that we were at 8, and we're not in pain, and we are not fatigued, and we are fully hydrated, people, please hydrate.
Mm.
Like all these things, we can make a lot more money. I love it. We can make a lot more money because we can be more productive. So it doesn't just benefit you, money wise. It doesn't just benefit you with your peace of mind and your job satisfaction. It doesn't just benefit you, it benefits your patients because they get the best version of you.
Yes. And hydration is very important. Like
Huge.
sometimes before I noticed myself getting tired, I chug a glass of water. All of a sudden I wasn't tired. I felt great. It's like, oh, just like a little plant wilting in the
Right.
you need water. Yeah.
Right. Well, as humans, we are 70% water.
Yeah.
So we need that. And I know that with the new PPE and all of the things, I know that it's harder,
Hmm.
but there is room for water in your day.
Hmm.
I have the OSHA regulations that say you can't have water in a non-sterile room. You can't have water in a room or in any cupboard or drawer that has dental materials that you access during the day during any dental procedure. So they say it specifically like that so that there is room for decision making from the employer. So if your boss says that cupboard that has binders in it that you never ever get to when a patient's in the
Hmm.
room, or old equipment or instruments that need to be turned over or whatever, and your room is sterile, meaning it's been cleaned and the next patient is not in it, it's sterile then you can drink out of it, or you can drink out of your water bottle, then you can drink out of your water bottle.
Hmm.
It's left, it's left to be vague in that way to say, look, guys, don't drink water when you have gross stuff in your room. These are common sense rules. A lot of what OSHA does is to protect us and to protect our patients from stupid decisions, right?
Right.
How are you going to open up a water bottle if you have gross stuff in your room?
Right.
So don't
Right.
do that. And don't put it in a thing in a drawer that you get to every day. Like if you're, people used to do gloved hands in a drawer and everything's contaminated. Hey, don't do that, right?
Yes.
But that one cupboard that many of us have with flushers or whatever.
Yeah. You should have
So
your own cupboard. You should have your own little locker in your operatory. because of
something.
that reason. You need your own little things in there because you can't take off all your PPE every time you want to run to the back to get a drink in between patients, which who has time? So many and people, hygienists don't want to drink water because they don't want to have to pee. Because they
Right.
don't have time. And then undressing all that PPE as well. And
Well, yeah, and we say
time.
that until we start having, bladder and kidney infections.
Yes. Yes.
And we're really fatigued and we're grumpy. And a lot of the times we don't associate fatigue and dehydration in the same circle, but they are very correlated.
Mm-hmm.
Just like what we saw when we came back, when we originally came back from all the lockdowns and everything, and we were putting like space suits on, right? Okay. And I recognize that some people are still doing space suits, and if that's your thing, good for you, whatever. But like most of us are kind of back to a more relaxed place. Either we've gotten very comfortable with our spacesuits,
Mm-hmm.
or
Mm-hmm.
or we are, we're back to wearing our level 3 with a shield, right?
Mm-hmm.
And we're doing our lab coats. So that's not too far off from where we were.
Mm-hmm.
And so we can take off our shield and our level 3 with our clean hands. Okay, that's one thing I love that COVID has given us. I'm just saying, people are so much cleaner. Anyway,
Yes.
with our clean hands, get in that door, take a quick drink, put it back, and go get your next patient. You're swallowing on the way down the hall.
Right.
We can do that. I do not go get my next patient without a drink of water.
Me either. I chug at least 4 ounces in between patients. Usually more, but yeah.
Yeah, I just get a nice big mouthful and there you go. I mean, they joke at me at work because I have chipmunk cheeks as I'm walking down the hall.
Yeah, always. Yeah, it makes a difference.
But sure. I'm hydrated, and I'll tell you this too. This is a fun fact. Dehydrated bones are the ones that end up with fracturing, disc fracturing. We know that skeletal changes occur more easily in dehydrated bones. So we have a lot of these younger people who are born with a cell phone in their hands, essentially, and they're doing this forward head posture all day long, right? Since they were, 3 years old or 2 years old and can hold a phone in their hands, and they have reversed necks. We're supposed to have a natural curvature that goes like this. I'm exaggerating, but not. The people in our age group, in our 40s, a lot of us hygienists have what they call straight necks, right? So our spine gets straight because we're doing this all day. The younger people with more pliable bones who don't drink water, their necks are going the opposite way. It is terrifying because I'm seeing 25, 26, 28-year-olds that need neck surgery, neck fusions.
Yes, there's so many young people having issues in hygiene or in dentistry, and that's way too young.
Yeah.
It is too young, but that's way too young. Yeah, I saw that on a news story or something where they're talking about the necks. They were showing x-rays of the younger people, and their necks are doing that. They're curved and they're almost like.
I've got a good one. You would love to see it. Oh my goodness. It is amazing.
Don't turn us into computers.
I know. I mean, it's on my slideshow actually, or my presentation, because I think it's important to see stuff like that.
Yes.
But and I mean, even just working around officer, one of my star clients, I just love her so much. She looks in her back x-ray that goes, literally from the top of her brain, all the way through her back. It looks like she was hit by Mack trucks. I mean, it's just messed up. That was a right-handed hygienist working in a left-handed room for 14 years. That's all.
14 years ago. Why didn't you switch it by then?
She loved her patients. The operatory could not be changed. The room literally could not be changed. Yeah, there was no physical way, but she loved her patients. She loved her boss. She loved her coworkers. She didn't realize how bad her back had gotten.
Yeah.
Her daughter one day took a picture of her standing up straight from behind, and she looked almost like the Hunchback of Notre Dame, but also to the side. Crazy. But she was in debilitating pain, like months, where she couldn't do anything.
Yeah.
Because she worked in a room that wasn't set up for her. So when I say operatory setup really matters, it really matters.
Yes. And so if you're designing a new office, especially a dental practice, have a dental professional in there to help set up. Even some of these great companies know what they're doing, but at the same time, you really need to have somebody like you. You should work for a company that does setups for that reason, for ergonomics, because that's so important for the doctor and who
Yeah, I have done that. I do consults with doctors who are doing build outs.
Okay.
I do consults with doctors who are remodeling. I do consults with doctors who are just saying, hey, I'm having this issue. What can I do? And I video conference and I'll say, okay, here's a patient chair that I recommend. Here's some equipment that I recommend. Let me look at your room. We'll video and I'll look at their room and things like that. I do that. I actually do that. That is
Okay.
yet another thing that I do.
Yes. Everything ergonomics. So I have a quick question. Can you give us a tip on positioning children? Do you work with a lot of children? Because you know how the chairs are so big, it doesn't fit anybody anyway. And so when you get a child in there, even though sometimes it's only for 20 minutes, it seems like we're really positioning ourselves awkwardly for that time.
So, yes. Okay. So first of all, let me just tell you, all hail to the pedo people. Okay. Mm-hmm. Your job is, I would say that a pedo practice is probably more difficult than surgical patients. Only because your patient has, fear and moves around constantly. And oftentimes, yes, the chair is just too big and all the things. So if it's specifically a pedo practice, I like those benches, the flat beds, as opposed to a chair. Mm-hmm. Because for multiple reasons, it's less fearful for them just to get up and lay down flat. Mm-hmm. As long as that bench goes up and down. The bench does need to go up and down. Mm-hmm. But also because kids are much more likely to raise their chin than adults will. And they have a lot more mobility to do so and flexibility. So it's not like you're saying, oh, raise your chin and they go, like that, like adults do.
Yeah.
You say, put your chin to the ceiling and they practically put it behind them.
They do, yeah.
They kind of do what they're told to a degree, right? So getting the flat benches that have the hydraulic lift in them, great idea for pedo. Also, bring them in close. Like, I know that the idea of getting really close to a child can be scary because of all the world. But just like adults, you got to get in there, get in close. Mm-hmm. And one of my favorite doctors, he uses, the new prismatic, the ergo loops that are out now, and loves it. But I would also say getting a saddle stool in a pedo practice is vital, vital. Because if you can't sit properly in that chair, you're really setting yourself up for a nightmare.
Right.
So those would be a couple things that I tell people with pedo. You gotta get rid of that big chair. Now, if it's a general practice, right, and you're dealing with the chair, well, then you're dealing with the chair, and you just scoot them up all the way, make their head go all the way to the top. That chair can handle a lot. Those kids are going nowhere, but you just say, "Come on, keep going."
Scooch up.
Yeah. And that's a big part of what I talk about is we have to train ourselves. But we also have to train our patients because it's not fair to them that we get frustrated with them when we don't train them properly. Mm-hmm. So if we don't tell them, keep coming, and keep coming, no matter what direction or thing that we're trying to get them to do, it's not fair to them that we didn't give them an expectation and we didn't tell them what we needed from them. And then we're upset because we're tired at the end of the day. It's not fair. They're not dental professionals. They don't know. So, of course, we all have, Mr. Cranky Pants who won't do anything that you say, literally ever. Those are the exceptions. Most of the patients, even though they all walk in and say, I can't lay back. So we all know better, Karen. So, exactly. So just lay back. And I blame it on autopilot. I say, okay, you don't want to lay back. I understand. The chair's on autopilot. We're going to bring you all the way down to where I need you, but then I'll bring you up to your comfort level. And when I do that, I let them go all the way down and they'll say, oh, okay, yep, okay, we're going to bring you back up. And if you start from the bottom, as opposed to starting from the top and saying, okay, I'm going to bring you back a little bit. Is that okay? Can I bring you back a little bit more? Okay, just a little bit. And then, you maybe get 3 adjustments if you're lucky. That's really all you have time for, and they're going to give you. So it works the same way on the opposite end. You bring them all the way down. Okay, I'm going to bring you up. Okay, is that okay there? Do you need more? Oh, okay, I'll bring you up a little bit more. And they're really only get maybe 3 adjustments before they're done and you're done.
Yeah, so you have to trick them. I trick my patients on everything in it. You have to for their own good. Because it's in there, sometimes they think that they're back where they're not. And if you let
Well, and the headrest, if you have an adjustable headrest,
Mm-hmm.
there are people who have vertigo, for example,
Mm-hmm.
and or people who have neck fusions, or there are those exceptions, that fit in this bubble.
So
And
save your body for those legit exceptions and don't schedule them all on the same day if possible.
Yes. Well, and use your indirect vision. And this is something that hygienists are terrible about. We don't like to use indirect vision. Dentists are amazing with this one, by the way, because they're in the same spot all day long and it's drilled into their head in school. So they're great about it, but they have their own set of issues. Hygienists, we are terrible with indirect vision. It's something we really would benefit a lot from just mastering if we would just sit down. It was actually a post I did during the shutdown. I was like, this is your opportunity to practice this at home. Get a shoebox, get a mirror, practice. You're sitting there bored watching Netflix. Do some indirect vision practice at home. We all did those exercises in school, right? Where you get the shoebox and you get your mirror and you trace a design or whatever. So the shoebox is in front of you so you can't see. And you're just using, some sort of a barrier. I don't know why we did shoeboxes, but so that way you practice. If you're sitting there at home, what else?
That's great. So can we share that? Because we'll share your links in the show notes, of course, but if we could share that post as well. Where would we find that? Is that in your private group, or is that?
That's on my Facebook page and group from 2020. So we'd have to dig a little bit to find it. But I'll see if I can find you I can get you a link for it.
Okay, but people can join your Facebook group, or is it for clients only?
It's all free.
Okay.
Yeah, the page is free, the group is free, the Instagram, all of that information, and I post daily on there's always something, whether it's nutritional information, stretches, ergonomic equipment, different exercises you can do, benefits of whatever, all the health things. I post every single day. There's always something, and that's free to anybody because I just really want to help people, right? Like that's what I do, and I'm passionate about it. Obviously, I'm a bit of a nerd about it, so the things that are an expense are things that if you're not paying for it, you're not going to do it. Right.
So, right.
Personal training.
So it's called ErgoFitLife. Okay. Yeah, I'm on there. I just want to make sure that the listeners can find it too. So ErgoFitLife on.
Yeah. So, I do have things like personal training and the ergonomics assessments and consultations and speaking and, all of those things. Obviously, I don't fly all over the country for free because I'm not a millionaire. I'm a hygienist. So.
Exactly. Yes. So as far as your group, so do you have where's the best place to find your business and how to hire you to come into practices or for one-on-one coaching or training?
So most people access me either through Instagram or Facebook on ErgoFitLife. Instagram is ErgoFitLife _Katrina. But most people message me, just private message me, or I've got my email is ergofitlife@gmail.com. You can try that too. I get everything. So go on my website, ergofitlife.com. Shockingly.
Yes, it's pretty easy to find you.
Yeah,
no excuses, people.
Yeah, so you can find me. I'm always here, and I love to help people. I'm answering questions all the time. Mm-hmm. I sell this product. What do you think about it? I do product reviews even. There's a ton of products that I've been asked, hey, do you want to collaborate with us? And I won't recommend a product that I don't believe in.
Right.
Whether they're sponsoring me or not.
Mm-hmm.
And most I'm not being sponsored with. I just like the product, and I want to put those products out for all of us, whether they're expensive things like microscopes or inexpensive things like the Cordy. So there's a lot on there, and I'm always here to field questions and help in any way I can, and all the things.
Okay, great. Well, thank you for joining us today, Katrina Klein, ErgoFitLife. We appreciate it so much and for giving so much of yourself to help others, and you shall receive in return, right?
Always. Yeah. Thank you. I appreciate you so much.
Yes. Thank you.
Have a great day.
Thank you for listening to this episode of the Dental Elements podcast. Be sure to share, like, and subscribe.